12 minutes past 8 o'clock. It is Monday morning, June 28th. Good morning, everyone. I'm Scott Michlin. Thanks for tuning in to KSJE 90.9 FM over the air here in San Juan County, New Mexico. 103.3 FM on the air in Durango, Colorado, and streaming everywhere from our website at KSJE.com. And that includes your smart speaker, everybody. Glad that you are with us. Welcome also to our viewers who are watching our visual radio program. We are streaming live this morning to the KSJE Facebook page and the KSJE Twitter account. We are glad that you are with us because this morning our topic is healthcare. We're going to be talking with representatives from beWellnm, New Mexico, beWellnm, talking a little bit about healthcare. So we hope you will stay tuned for that. It is coming up in the next few moments right here on KSJE. Then later on this morning, we'll be talking with Lewis Campbell from Synergy Computer Systems. It's our weekly technology segment called Monday Reboot, coming up this morning at 8:50 a.m. on KSJE. Next hour, Roving with the Arts, our classical music program. Mick Hess is here with us this morning, and he will be playing music from the great Igor Stravinsky. That's coming up next hour on Roving with the Arts today on KSJE. And don't forget, of course, in addition to our Facebook and Twitter pages, you can also connect with us on our YouTube channel and our Instagram page as well. Let's talk about the weather forecast, shall we? Outside our studios this morning, it is mostly sunny this morning, 60 degrees at the moment. We are expecting a partly sunny day today with a chance of a scattered shower or thunderstorm popping up. In fact, that's the forecast for much of this week. Today's high, though, 81 in Farmington, 60 overnight. It'll be 78 tomorrow, 82 for a high on Wednesday, warming up to 87 on Thursday, 88 by Friday, and maybe 90 for the weekend, but there's still that chance of a shower in the forecast over the next several days. So we're looking forward to maybe some precipitation. That would be nice to get. So we'll see if those things come to fruition. But let me introduce my guests who are joining us this morning on a Zoom call today from beWellnm, beWellnm, New Mexico, of course. Misty Dickens is joining me via Zoom. She is the Community Engagement Specialist with beWellnm. Misty, good morning. Thank you for joining me this morning.
Hi, good morning. Yeah, it's good to get online today and interview.
Glad that you are with us. Thank you very much. And of course, also joining us is Juliet Yazzie. She is the Native American Specialist. And Juliet, good morning to you. Thank you for joining us this morning.
Good morning, Scott, and thank you for having us.
You bet. Great to have you with us as well. Appreciate both of you coming on the program today to talk a little bit about beWellnm. And so let's get started by talking with Misty a little bit about this enrollment period that's been open now from since April, correct? And it allows folks maybe who need health insurance to go online and look around and see what they're eligible for, right?
Right. And it actually began February 15th. So that's when the special enrollment period began. And then April 1st was the date when the American Rescue Plan additional financial assistance went into effect. And then so the special enrollment period is ongoing now, and it goes until August 15th.
Got you. Thank you. I knew there was something about April that stuck in my head, but it wasn't that it started. But this is new this year, correct? I mean, normally we're talking about enrollment periods towards the end of the calendar year, aren't we?
Right. So normally the enrollment period is usually November 1st through December 15th. But due to the pandemic, it was extended and opened again February 15th. And it is now ongoing, so if anybody enrolls today, their plan will begin July 1st. If they enroll in July, it'll begin August 1st.
Got you. Very good. And so let me turn to Juliet to talk a little bit about her work with our Native American communities. And, of course, this is important for them as well to be able to access additional health care services and things along that line. Tell us a bit about your work with them.
That is correct, Scott. So Native Americans actually have the opportunity to enroll in health coverage year-round. So they're not confined to just the traditional open enrollment period. But this is a very unique opportunity for all New Mexicans to take advantage of. The special enrollment period, which ends August 15th, is a very important time for folks to go ahead and get enrolled into health coverage. As Misty said, the American Rescue Plan went into effect on April 1st. And so now there is additional financial assistance that is available to help help folks pay for their monthly premiums. And so we have found that 4 out of 5 New Mexicans can actually qualify for a health plan for less than $10 per month. So again, this is a very unique opportunity for individuals to go ahead and get enrolled in health coverage. And many Native Americans actually qualify for what we call zero cost sharing, which means very limited out-of-pocket costs. So they would not have to pay any co-pays such as or any out-of-pocket costs such as co-pays, deductibles, or co-insurance and things of that sort. Many would just be responsible for a monthly premium. And as I said, a lot of folks qualify for a monthly premium or less than $10 per month.
Right. Very interesting. And this would be in addition to the care that Native Americans can receive through the Indian Health Service, correct?
That is correct. And also, if any Native Americans are outside of their service area, they'd actually still be able to get services that they may need, even emergency services. Say you're traveling out of state and you're outside of your service area, being that you're on vacation or something like that. All of those emergency services would actually be covered out of state as well. So you have coverage and that peace of mind that in case you find yourself in an urgent or emergent situation, that you do have that coverage.
That's a really good point and important for folks to consider for sure. And Juliet, before I go back to Misty with a couple of questions, what's the biggest question that you hear from folks that you are working with from the Native American community? Is there one overriding question that they have about getting health care or some of the options that they can see on the beWellnm website?
I think the biggest question that we tend to see is cost.
Mm-hmm.
A lot of folks are really we're really in really tight budgets these days, considering the times that we're in. We've had a really rough past year, and so I think a lot of folks are really worried about how much the cost can be. But like I said, many folks qualify for a premium of less than $10 per month, so it's more affordable than people may think. So I strongly encourage individuals to visit our website, beWellnm.com, or give us a call at 1-833-862-3935. And you'll be able to speak directly with one of our certified experts that can either generate you a price quote or automatically help you get enrolled.
Very good. Thank you very much. And let me go back to Misty Dickens with kind of a similar question. Misty, from the folks that you talk with and help, what's the main question that they have for you? Is it cost, as Juliet was saying, or something else?
Sometimes it's cost, yes, and then they look at who's in their network. So a lot of the time they're looking at if these plans cover their doctors, their pharmacy, urgent care, and then they look at their drug costs for their prescriptions. So it's a lot of information to look at. You look at the premium, the cost of the plan. You look at deductibles, co-pays, co-insurance, out-of-pocket costs. So that's what beWellnm, we're here to help navigate through that whole process. Help you through the application process, and then looking at those plans and prices and the details of those plans.
Right.
And there are 5 carriers available right now on the marketplace. So that's what beWellnm helps with, is just navigating that whole process.
Very good. Well, and I know healthcare is a bit complicated, and it's very individual for families and folks who are looking and shopping around for healthcare if they don't happen to get it through their employer or what have you. And so it is kind of a big deal, right, when you're sitting down to try to make these really important decisions about what type of coverage I need or what type of coverage my family needs, and looking down the road and trying to figure out what's in network, as you mentioned. What covers my prescriptions, what covers my children, all those different answers and questions, right?
Right. So that's what we help with. Again, it's just, and then our help is free, so there's no cost to the consumer. beWellnm has agents, brokers, and enrollment counselors across the state, and where they can assist with looking at these plans and prices, and just, again, help navigating the whole process.
Right. And I know, I think I know that the whole idea behind the health insurance exchanges and offering different plans and different levels and offering financial assistance for families who may need that, this is all came from the Affordable Care Act, if I'm not mistaken, correct?
Right. So the Affordable Care Act, when it was enacted, it helped open up the choices for everybody to have coverage on the exchange. It also expanded Medicaid. So New Mexico has an expanded Medicaid program where more individuals are able to qualify there as well. So, and if you're not eligible for Medicaid, then you then look at what your employer offers. If your employer doesn't work, then you would go then to the marketplace.
Right, and that's
they don't
what
offer you coverage. I mean,
exactly.
That's correct. And also, as a part of the Affordable Care Act, folks cannot be denied coverage or charged more for any pre-existing conditions that they may have as well. So that's a very important clause that we have found also, because a lot of folks think that, oh, well, I have diabetes or something like that, I'm going to get charged an arm and a leg, when in fact, no, you cannot be charged more or denied coverage based off of any pre-existing conditions.
right.
And that's a great point, and thank you for making that, because I know in some of the other conversations about health care reform or making changes to the Affordable Care Act or replacing it or what have you, that's been a really big topic about kind of preserving that pre-existing condition part of the Affordable Care Act, and that's really, I think, made a big difference for a lot of families and a lot of folks who maybe had trouble before even finding affordable health insurance, correct? I mean, it really was a game changer for a lot of folks who maybe you couldn't get coverage before because of a pre-existing condition, wouldn't you say?
Yes, that is correct. And then also, as a part of the Affordable Care Act, many folks also qualify for advanced premium tax credits, which can be used towards their monthly premium to reduce that out-of-pocket cost as well. And again, like I said, with the American Rescue Plan going into effect, a lot of folks actually qualify for premiums less than $10 per month.
Very good, and that's important. And so, what would you both say are? Do we have a kind of an estimate of the number of families or individuals in New Mexico that still are needing health care, who have not yet taken advantage of the exchange or gone online to look for a plan? Do we know what that number might be?
Well, for San Juan County in particular,
Yes.
there's an estimated 21,000 uninsured. So that's based off the Urban Institute data. So of those, 4,202 are eligible to receive healthcare financial assistance. And that's why we're here, is just to make them aware that you could get a plan on the marketplace, as Juliet was saying, less than $10 a month. You just you don't know until you do the application or get a quote. Call us and get a quote.
Right, and that's important to note. And so, with folks being able to do that, and that's a lot of people. You mentioned 20,000, and of that, almost more than 4,000 could be eligible for these programs that you're talking about. And so, for folks who maybe think it's just too daunting or complicated, as I mentioned, you talked about this earlier, I think, Misty, that you've got folks available to talk on the phone to take people through step by step of what their options are, and once you know what their income level is and the numbers of people in their family, that changes all the numbers, right? It's a really individualized process.
Right. It's different for each individual, each family. And again, we do have that free assistance available through agents, brokers, and enrollment counselors.
Very good. And would one of you share the phone number again for folks who are listening and watching us this morning, if they do want to take advantage and call and get some help?
Yep. Our phone number is 833-862-3935.
Very good. And you're open business hours or longer than that?
Yes. So we are open Monday through Friday from 8 to 5.
Got you. Good to know. And so again, and for folks who are listening and watching us this morning who maybe they have health coverage, maybe they know someone in their family or a friend who does not, the best thing to do, I guess, would be to point them to the website or to one of the folks on the phone to get more information.
Yeah, so the website, beWellnm.com, we do have a chat feature on there as well, where they can get more information or set up their virtual appointment. And again, calling us Monday through Friday, 8 to 5. That is a live, we are answering those phones live, so they can speak to an enrollment counselor knowledgeable about the healthcare plans.
Right. Very good. And Juliet Yazzie, I want to come back to you and ask you a bit about your work with the Native American communities. And of course, as we mentioned, you know, Indian Health Service offers medical care in certain service areas, but of course, not everyone lives near one of those medical facilities or hospitals. And so that is the reason for additional coverage or travel, as you mentioned, and things along that line for that specific part of our population, correct?
That is correct. And as Misty had mentioned earlier, we do have 5 carriers that are available through Mexico Health Insurance Exchange, and all of those carriers offer coverage across all 33 counties across the state of New Mexico as well. So having health insurance is a very important thing. Like I said, you never know when you can find yourself in an emergent or urgent situation, and so it's good to have that peace of mind knowing that you are covered should you have an accident or situation occur where you find yourself ending up in an emergency room or something like that. So having health insurance is a very important thing. And again, many Native Americans qualify for limited out-of-pocket cost and even a very minimum premium. So we strongly encourage folks to just take a look at what you may qualify for. You may be surprised at the savings that you can have.
Right. Very, very true. And Misty, for the work that you do, again, same type of question for families with children and things along that line of getting everybody on board from those 5 companies that are offered on the exchange. Are there different levels of coverage then for each of those companies? Can folks still have more choices than just 5?
Yeah, so there's probably about 36 plans available between the 5 companies.
Okay.
And then there's different metal levels. So there'll be a bronze, silver, and a gold. And they just have different deductibles, different co-pays. But again, sitting with an enrollment counselor or an agent or a broker, they do go over all of that with you and looking at the different metal levels and looking at the cost of each one.
Right. And so for both of you, I guess, what would you recommend folks maybe have nearby or at their ready before they call or go online to the website to maybe make the process a bit smoother, a bit easier? I mean, income information or pre-existing conditions or prescription types and costs? What would you say?
Prescriptions, and then your network. So if you have a doctor that you want to stay with, and the income information, and then just your household information as well, your tax household. Right.
Very good. And Juliet, anything different for the Native American residents in New Mexico?
Yeah, so for Native Americans that wish to apply for health coverage, excuse me, through beWellnm, we would actually need a tribal ID card or a CIB, Certificate of Indian Blood, that can show proof that you are a member of a federally recognized tribe.
Gotcha. That would certainly be a big thing to have for sure. And other income or other things like that too, is that helpful or not as much?
Yes, that is very helpful actually. So things that we would need to submit an application would be like names, dates of birth, social security numbers for those that wish to apply, as well as income information for your tax household, like Misty said. And then again, tribal ID cards or CIBs if you are indeed a member of a federally recognized tribe.
Gotcha. Very good. And so again, this open enrollment period is ongoing through the middle of August, correct? August 15th. And
Yes.
And then after that, things will shut down again until the end of the calendar year. Is that your understanding?
That is correct. So the ongoing special enrollment period ends August 15th. If you miss this special enrollment period, folks will not be able to enroll until the traditional open enrollment period, which begins November 1st, and that is for coverage to begin on January 1 of 2022.
Right.
Got you. And also during these enrollment periods, isn't this also a time for folks to maybe switch their coverages if it's not working out for them, or they're looking at something different, or want to make a change? Is this a good time to do that as well for existing customers and residents?
Yes, that's a great question. That is correct. So any folks that are wishing to make a change, say their doctor may have moved to a different network or something like that, or they wish to go to a different facility or clinic, now would be the time to actually go in and make those changes through your application. And as Misty said, we do have certified agents, brokers, as well as enrollment counselors available across the state that can assist you with plan selection to ensure that you're making an informed decision when it comes to your health coverage options.
Very good. And Misty, what would anything to add to that answer?
No, just that if they do have an existing plan and they haven't redid the application, they could also receive additional financial assistance on their advanced premium tax credit. So that's another thing, is that if they do report a change and go through their application again, they may get that additional financial assistance applied for their next month.
Right. And it seems to me that during the pandemic, we learned a lot about the gig economy. These are folks maybe doing their own, working for themselves almost. Maybe they're web designers, maybe they're Uber drivers, things along way, or food delivery drivers, and so they don't have, obviously, health insurance from their employer. And so this is kind of also what the exchange has been built for, right? Or some of these people in our society?
Right.
Correct. So any folks that do not, say, qualify for the state's Medicaid program or are not offered coverage through their employer can actually enroll into the beWellnm New Mexico Health Insurance Exchange and possibly get the tax credits. And again, 4 out of 5 New Mexicans qualify for premiums less than $10 per month. So I strongly encourage folks that if you're interested, just take a look. You may be surprised at what you qualify for.
Right. True. And of course, the cynic in me would say, well, maybe that's $10 a month, but maybe the deductible is really high, or what have you. But it really does depend on the family situation, I suppose, right?
That is correct. But depending on household size as well as household income, that would help us determine whether or not you'd qualify for that additional financial assistance to reduce those monthly premiums. And a lot of times folks actually qualify for limited cost sharing as well, which reduces those out-of-pocket costs like co-pays and co-insurance as well as deductibles.
Good to know. And it seems like we hear a lot in the media about the high costs of health care. So maybe, I imagine maybe you get some calls from folks who maybe can't believe when the numbers come out just how little they're paying for healthcare coverage, or what tax credits they're eligible for, or all these different things that are available to lower the overall cost of healthcare for these families. Misty, do you ever get a question like that or a reaction like that?
Yes. So we do have individuals asking about costs, and again, it's just this American Rescue Plan Act, or the COVID-19 relief legislation that was passed by Congress, just provides more financial help for more people. So it just leads to big savings for New Mexico residents. So a family of 4 earning $90,000 can now save nearly like $2,500 per year on their health plan. Wow,
that's significant. So good to know. And Juliet Yazzie, with these tax credits that you've been mentioning, are those are they permanent? Are they going to expire after a certain amount of time, or do we not know? Does it just kind of depend on what happens with federal legislation? How can you help people kind of plan for the future when they have these things right now, which are great, but will they last?
Yes, so premium tax credits are ongoing, depending on your household income. And the additional financial assistance, which increases the advanced premium tax credit amounts, is actually ongoing as well. And so we strongly encourage any individuals that are currently enrolled, if you have not updated your application, go through and update your application, because there is now additional financial assistance available to help reduce those monthly premiums.
And I guess updating that application is really important as well, because if I was laid off for a time last year, or my income went down significantly or even a little bit, that might impact, obviously, some of the things that I'm eligible for, wouldn't it?
Yes, that is correct. So if you did have any changes within the past year, you want to make sure that your application reflects those changes. Especially if you did have a change in income, you want to make sure that you update your income information on your application to ensure that you're receiving the correct amount of premium tax credits.
Good to know. And again, this is the time to do it. Enrollment is now open between now and August 15th, and so folks can go in and update their applications. Even after the 15th, you can't update your application, can you?
Yes, you can. If you do experience what we call a life change, you want to make sure that you report those changes as soon as you can.
Got you. So that's okay all the time, but switching insurance coverage plans and things like that is only available during these enrollment periods, correct?
That is correct.
Got you. Very good. We'll just have a couple of minutes remaining this morning with both of you. I thank you both for your time, because, as I said, I know healthcare is complicated, and a lot of folks just kind of, hold their head and just kind of would rather do anything else than having to deal with the decisions and the different levels and all the other things, because they're making these important decisions. But it's good to know that there are folks available to help guide people through the system. And so again, Misty Dickens, this is kind of what you and your team does for folks who are calling in or chatting online to help them try to decide what might work best for them and their families.
Yes. So we have a call center here. We're located in Albuquerque, but we have our call center open, and the enrollment counselors there are knowledgeable about the plans, and they can set you up a virtual appointment, again, with an agent, broker, or enrollment counselor.
Very good. Good to know. And again, Juliet Yazzie, for our Native American communities. Again, you've got folks available to help them as well, don't you?
That is correct. So we do have assisters available across the entire state. So if you're seeking for any in-person assistance, you can give us a call at 833-862-3935, or you can visit us online at beWellnm.com to locate an assister closest to you.
Very good. Well, again, thank you both for joining me this morning. I do appreciate it. And again, we have until August 15th to make any changes, to ask questions and get help with beWellnm.com and look at some of the options for healthcare in our state. And I think, as we have seen, it's been great to see a lot more people eligible for healthcare and signing up for healthcare, and hopefully we have a lot more healthier New Mexicans because of it, right?
That is correct.
Right.
Very good. Well, thank you both very much, Misty Dickens and Juliet Yazzie from beWellnm. I appreciate your time this morning. Thank you.
Thank you, Scott.
Thank you, Scott. Thank you for having us.
You're very welcome. My guest this morning right here on KSJE. The time is 8:38.